Rural healthcare is itself sick. Not enough doctors or specialists or nurses. And the hospitals and clinics themselves are just barely hanging on, in many cases partnering with big city networks to stay afloat financially. We're witnessing this in real time here in the North Country with the North Star Health Alliance. People are fighting against its plan to close its birthing unit in Ogdensburg and its sleep lab in Carthage. But officials say if they don't close them, it could be even worse. That's today's story of the day.
Support for Story of the Day comes from the Clarkson School, offering advanced high school age students the opportunity to start college early at Clarkson University. Clarkson.edu/TCS.
Hey, I'm David Sommerstein. It's Friday, July 31st. First up, U.S. Health and Human Services Secretary Robert F. Kennedy Jr. visited Fort Drum yesterday. WWNY reports he praised the Army base for serving as a quarantine location earlier this month for 14 people returning from the Democratic Republic of the Congo, where there's an ongoing Ebola outbreak.
Incredibly accommodating on a very, very short notice. A lot of the discussions about this happen in the middle of the night because we wanted, there were issues including the potential of infection, and we needed a lot of cooperation, and we got that from Fort Drum.
Kennedy and celebrity chef Robert Irvine were at Fort Drum for the ribbon cutting of a new campus-style dining hall called the Belvedere Bistro. The two have been collaborating to update military dining options. Kennedy said mission readiness begins with nutrition. The New York State Fair opens in less than a month, and this year there's an added bonus for students who attend SUNY colleges. David Bullard with the New York Public News Network reports.
In a little over a month, the state's largest annual festival returns for its 178th edition when the Great New York State Fair opens its gates, lets loose its rides, and cranks up the music. What's up, Syracuse? This year, there's a little bonus for students at SUNY colleges. Free admission on day 2 of the fair called Student Youth Day. Katie Ray is the fair spokesperson.
We try to make the fair as affordable as possible, and we are one of the most affordable fairs in the country. We think this is just another way to offer students the opportunity to expose them to what's great about our state.
Student Youth Day features free admission for anyone age 18 and under, but SUNY students with a valid ID and an admissions letter will also get in for free that day. Several SUNY colleges take active roles in the fair, and on Student Youth Day, SUNY Cobleskill will highlight careers and technology in agriculture on what is also Agriculture Careers Day. The fair features scores of food and drink vendors, dozens of rides in the Wade Show's Midway, special events, and, says Katie Ray, some new twists for 2026.
What we have really focused on this year is making the fair something for everyone. We have new programming in the Empire Room this year that we think is really dynamic. It's really fun. So you can come in, you could do a trivia night, you could do emo night. We're doing line dancing. There's speed dating. There's a number of things that all is included with it, the price of admission.
On the stages for Student Youth Day, 90s hit band The Calling and modern country artist Cooper Allen are on Chevy Court, while a large audience is expected for Grammy-winning reggae and rap star Sean Paul. For the New York Public News Network, I'm Dave Bullard.
The healthcare network that operates 2 hospitals in the North Country is on thin ice. Earlier this year, the North Star Health Alliance filed for bankruptcy, fired employees, and cut essential healthcare services. Then this month, North Star announced that it's cutting its labor and delivery services at the hospital in Ogdensburg. But this closure would need state approval first. And on Wednesday, North Star held a public hearing in Ogdensburg to address the community's concerns. Richard Haller was there and has our story.
Members of the state's nurses union, local political leaders, and community members gathered in front of the Ogdensburg Free Academy.
We say no. 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 Hell no. To this closure now.
At least 300 people showed up to call on the Department of Health to stop North Star from closing its birthing unit at Claxton Hepburn Medical Center. Cynthia Small lives in Ogdensburg. She said she's here for answers.
I would like to know if any more programs are going to be cut. Hospitals have to be run efficiently, and they have to make a dime or they can't provide services. But, nobody wants to have to drive half hour away.
What do we want? What do we want?
People poured inside and filled up the seats in the auditorium for the official hearing. The proposed closure of the birthing center in Ogdensburg comes after a year of financial turmoil for the healthcare network. North Star failed to provide the Department of Health with information on how it used past funds, which led to its former CEO resigning, mass layoffs, cutting of services, and bankruptcy. North Star officials sat on stage as more than 30 people spoke against the proposed cuts. Selena Burns was born at Claxton Hepburn.
These are people, and I have had the experience of delivering 5 children at Claxton Hepburn Hospital. All 5 pregnancies were complicated. All 5 deliveries were complicated. And I probably wouldn't have my 5 children today if that department was not there.
Many nurses and doctors said they are worried about what this closure will mean for the North Country community. Some people would have to drive at least an hour to give birth, and nurses at the hospital in Potsdam said they don't have enough beds already. Alicia Crossman is a nurse at the Claxton Hepburn Hospital.
After 25 years of serving this community, I know what our patients need because I've been there with some of them through the best and worst moments of their lives. I urge you to keep this OB department open, not just for today's families, but for generations to come.
The birthing center in Ogdensburg isn't the only service facing closure under North Star. There are proposed cuts to the sleep center at Carthage Area Hospital, as well as primary care and physical therapy services at the Philadelphia Medical Center in Jefferson County. CEO Andrew Manzer and North Star Chief Operating Officer Jerian Odell listened to the public comments. Odell agreed that the situation is dire.
You're awarded financing. That does not get us through the end of the year. That's the real state of emergency that we're in.
Odell said these cuts are intended to save the rest of the hospitals from closing, including the Meadowbrook Assisted Living Facility and the Ogdensburg Cancer Treatment Center.
I personally am not just worried about the next OB patient. I'm worried about the 55 residents who live in Meadowbrook and Carthage. I'm worried about the numerous cancer patients that come through our amazing program that we have.
Afterwards, North Star CEO Andrew Manzer said he appreciated how many people showed up. He said it sends a message to Albany that help is needed.
And that actually gives me a lot of confidence, more confidence than I had walking in today, that the challenges we have will be overcome.
The Department of Health said last week that it's identified Rochester Regional as a potential healthcare partner for North Star. Manzer said this will be a lengthy process, but that he's hopeful it'll come to fruition to stabilize the hospitals. Jessica Thornton is a surgical nurse at Claxton Hepburn. She said these cuts are part of a gutting of healthcare across rural communities.
The broader concern is completely and totally lack of access to care. Rural lives matter just as much, and our healthcare matters just as much. And unfortunately, a lot of people in these areas are low income, low socioeconomic status, so they don't have the means to get where they need to go, so they go without care.
Many people at this hearing called on New York State and the Department of Health to step in and help prevent North Star from closing its labor and delivery services in Ogdensburg. Assemblyman Scott Gray said it's essential that these services remain in these communities and that the state should look at every available option before making a decision. Richard Haller, North Country Public Radio, Ogdensburg.
It's the final day of our summer fundraiser, and it's just us now. Our federal funding was cut last year, so all of us have to make back that $330,000 every year just to keep NCPR stable. So when you give now at ncpr.org/give, you're the foundation holding it together for local news, for responsible fact-based reporting, for fun voices and delight and audio postcards in the woods. Give right now at ncpr.org/give. Thanks so much for all you do for your public radio station. Music today by Mark Corey of Watertown and Patricia Julian of Burlington. Have a great weekend. I'm David Summerstein, North Country Public Radio.